Colon cancer is the third most common cause of cancer in the US in both men and women. It is also one of the deadliest cancers. But there is a natural explanation why you get colon cancer and ways to fix it. In this video, you're going to learn what colon cancer is and common symptoms you can experience. Then I'm going to talk about colon cancer causes and what you can do about it. So let's learn what the purpose of the colon is. The small intestine digests and absorbs the nutrients contained in the food. Undigested food then enters the colon. The colon acts as a storage facility for waste, but it also removes water, salts and some vitamins. Also, colonic bacteria digest some of the undigested food, for example fiber. The undigested food arrives at the rectum and initiates a bowel movement that empties the colon. The colon is about 6 feet long and wider than the small intestine. So what is colon cancer? Colon cancer is cancer of the large intestine, which is the final part of your digestive tract. Most cases of colon cancer begin as small, noncancerous clumps of cells called polyps. Over time, some of these polyps can become colon cancers. Cancers of the colon and rectum start when the cells begin to divide out of control. Polyps vary in type. Most of them are harmless, but some can turn into colorectal cancer. The two most common types of intestinal polyps are adenomas and hyperplastic polyps. They form when there are problems with the way cells grow and repair in the lining of the colon. Signs and symptoms of colon cancer include a change in your bowel habits including diarrhea or constipation, rectal bleeding or blood in your stool, persistent abdominal discomfort such as cramps, gas or pain, a feeling that your bowel doesn't empty completely, weakness or fatigue, or unexplained weight loss. Many people with colon cancer experience no symptoms in the early stages of the disease. When symptoms appear, they vary depending on the cancer's size and location. So let's talk about colon cancer causes. One reason for colon cancer is emotional stress. Dr. Hammer is the founder of German New Medicine. He worked at a cancer clinic in Munich in Germany. After his son died, he developed testicular cancer. He wondered if his cancer had to do with the tragic loss of his son. Dr. Hammer obtained brain scans of all his cancer patients. He then compared the CT scan with the patient's medical records and history. All his patients experienced an unexpected shock before cancer diagnosis. Hammer discovered that a particular area of the brain controlled a specific organ. Each conflict shock affects a unique part of the brain that relates it to the organ. So every cancer has a distinct conflict shock. Dr. Hammer found out that a disease runs in two phases. We have the active conflict phase that activates the moment we have the shock. Cancer grows in the active phase. At the moment we resolve that conflict, we enter the healing phase. In this state, the tumor stops growing and shrinks. Cancer is not a disease but a biological conflict. Our bodies go into fight or flight mode if there is an immediate danger. The danger causes a specific biological response. Both animals and humans experience these conflict shocks. The difference between humans and animals is that humans can think. Our bodies can't see the difference between an imagined or a real situation. For us, a negative remark can cause an attack conflict. If we lose our income, then that can trigger a starvation conflict, and so forth. When we experience a specific emotional struggle, it activates a particular biological response. It's not the situation that causes the shock, but our perception of it. Every conflict shock is individual. 3 people can experience the same negative situation and react differently. Our reaction depends on our beliefs, values, or our vulnerabilities. So this is what Dr. Hammer discovered about colon cancer. The biological conflict linked to colon cancer is an undigestible morsel conflict. For animals, an undigestible morsel is a real piece of food. For humans, it can also be a figurative morsel, for example a car, a house, or a valuable object. You might perceive an unpleasant event as a morsel and suffer from it. This conflict might feel as undigestible or non-absorbable. For example, when an anticipated purchase, promotion, or promise cannot be taken in. The conflict is ugly, such as fights over money or a property, or it can be because of a nasty divorce, court case, or betrayal. During the conflict active phase, cells in the large intestine multiply. The intensity of the conflict affects the growth rate. The biological purpose of the cell increase is to ease the digestion of the morsel. Animals experience a morsel conflict when food or a bone gets stuck in the intestine. This emerging situation starts the biological program to deal with this. Intestinal cells immediately start to grow at the site where the morsel is stuck. The biological purpose of the cell growth is to produce more intestinal cells. This process also creates more digestive juices so that the chunk breaks down and passes. The moment you experience the shock, it impacts the area in the brain that controls the colon. And as soon as the brain cells receive the shock, they relay to the colon. For example, a man's business partner betrays him, and he loses his company because of it. So his colon cancer grows because of this undigestible betrayal. A man retires soon, and his employer promises that he will get a pension from them. But then he learns that he won't receive his retirement. If he can't digest this dispute, then that can trigger a morsel conflict. So to reverse colon cancer, one has to resolve the emotional conflict that triggered it. You can learn how to do that in this free workbook. The link is in the description. Another risk factor for getting colon cancer is our diet. Colon cancer is most common in wealthy countries where people consume animal products. They eat poultry, fish, dairy products, vegetable oils, and processed foods. The healthiest people in the world eat lots of whole grains, vegetables, and fruits. And they have little animal products and lower colon cancer rates. But as they eat the Western diet, they get colon cancer. So there are many kinds of carcinogens found in the American diet. Fats, especially beef fat, create cancer-causing substances in the colon. Other risks in meat include animal protein, cholesterol, IGF-1, and HCAs. The World Health Organization hired 22 experts from 10 countries to study the risks of meat. These experts went through more than 800 studies. They looked at studies that linked cancer to red and processed meat. They classified processed meat as carcinogenic to humans, and they declared red meat as probably carcinogenic to humans. Each 50-gram portion of processed meat eaten daily increases the risk of colon cancer by 18%. The key to preventing colon cancer is to change your diet. Switching to a low-fat diet reduces the total amount of carcinogens in the colon. You can do this by eating a whole food, high-carb, low-fat, plant-based diet. Foods that are good for cancer include broccoli or cauliflowers. Brussels sprouts, turnips, and leafy greens also fight cancer. If you want to avoid cancer, you need to stop eating all animal products, including eggs and dairy. Also stay off processed food and junk food. Eat lots of unprocessed starches and vegetables. To Today I talked about colon cancer causes. Most cases of colon cancer begin as small, noncancerous clumps of cells called polyps. Every cancer has a distinct conflict shock. The biological conflict linked to colon cancer is an undigestible morsel conflict. It can be because of a fight over money or a property, or because of a nasty divorce, court case, or betrayal. Animal products and our diet is another risk factor for getting colon cancer. After watching this video, you should now know that there is a national explanation why you get colon cancer and ways to fix it. Download this workbook for free to learn how to treat colon cancer naturally. Discover how to fix the emotional conflict linked to colon cancer and more. The link is in the description. If you enjoyed this video, then press the like button and subscribe to the channel. Share this video on social media with your families and friends. Please visit our blog at cancerwisdom.net to learn non-toxic ways to treat cancer. You can also download more free documents in our free resource library. Thanks for watching, and I'll see you soon.